The next task is that Ronnie, he is a 8-year-old boy. He has tummy pain, and that is diagnosed as a functional abdominal pain. Mother is Mira. Mother is very much crazy because she wants to do test like jelly scan, CT scan. These are she wants to do. But you have to now convince her this the cause is functional abdominal pain for stress that is going. Now you have to discuss with Mira. The son is Ronnie. He is 8-year-old. Okay. Okay, Hina.
Okay. Yes.
So you want time?
Yeah, no, no, I was start now.
Start.
Okay. Hello, good afternoon.
Good afternoon.
I'm Dr. Teresa, one of the child doctor. I believe I'm talking to Mrs. Mira, moms of Rooney.
Yeah, yeah. I'm Ronnie's mom, Mira.
Okay. Thank you for coming to see me, Mrs. Mira. I'm here today because I want to discuss about Rooney condition. Is that okay for you?
Yeah, it's okay. I'm here to talk with
Okay.
you.
All right. Would you like anyone to join with us today?
No, you can
Okay.
continue with
Before
me.
I Sure. Before I discuss further, I want to ask you how far do you know about Rooney conditions?
What happened? Ronnie has tummy pain, and I'm here to do the jelly scan test. I want to know what is inside him.
Okay. Is there any specific reasons why you want to do this jelly scan?
Yeah, yeah, of course. Ronnie has this tummy pain. It just making me crazy. And also, I want to tell you one thing that, Ronnie, one of neighbor child, he has also like that tummy pain. Later, he discovered that it's a cancer. So I have to do
Um,
that test.
I'm really sorry for that neighbor child. I hope he is okay at the moment. I can see where your concerns came from now. But Mrs. Mira, I want to tell you one thing is that we have done the proper examinations to the RONI. The good news is that while we do the thorough examinations, we could not find out anything that would probably suggest seriousness like cancers to the rheumatic pain problem. Are you with me so far?
Yeah, I'm with you, but I want to do the jelly scan.
I can totally understand your concerns, but you know what? We can arrange a jelly scan, but it would take time, and really need to have a specific waiting time in order to have this scan. It is not necessary. What we found out is that rheumatic pain is probably related to what we call as a functional abdominal pain. Have you ever heard about that terms before?
No, I have never heard. What is that?
Okay, so that's a very good thing. I will explain it to you. So normally, the functional abdominal pain is like childs experience tummy pains when they have a certain stress in their life, because sometimes tummy movements is associated with the brain comments. So when their brain is having stress or anxious, they just put so many information to the tummy, causing the tummy to move too much and causing the pain a lot. But it does not relate it to the underlying tummy problems, or there isn't anything wrong inside the tummy organs. Are you with me, Mrs. Mira?
Yeah, I'm with you. Okay, doctor, then do the CT scan. I want to do the CT scan of my child.
I can totally understand, and maybe because you have a witness that neighbor child got a cancer, and it might be the reason why you want to do those tests. However, if I would explain to you why we do not think this is beneficial for Rooney to have those tests, is that first of all, CT scan has a very very dangerous radiations exposures to the child. We normally do not do CT scans if it is absolutely not necessary for the child. And we can give you a lot of the option available to help with this tummy pain, and we can wait and see whether that options will help with the Rooney tummy pain or not. How does that sound? Would you like to wait and do the options that I'm going to give you to help with the tummy pain?
And then why are you not doing the jelly scan? Simple jelly scan, you can do that.
Of course, jelly skin we can do that, but first of all, it will take times to get a appointment for that jelly scans, and we if you want, I can arrange that. However, I think that even though you do the jelly scan, there won't be anything, specific problems that came up, because the problem is not inside the tummy. The problem is probably related to the brain comments into into the tummy. So what I suggest you is that how about we try the way to handle the stress, or how about we try a bit of lifestyle changes, and then we can see whether tummy pains improve with times or not. If not, then we can discuss for the jelly scans of the tummy later.
So you are not giving any treatment for tummy pain for Ronnie?
I can understand your worry. No, we are going to give you the options. There is a treatment options. One is the non-medical treatments, other is medical treatments. Non-medical treatments is as simply as it is, like we will give you the options to reduce the stress levels of the child, how to handle the stress. For example, child yoga, child breathing techniques, or giving the exposure to outdoor activity as much as possible. Those are probably the one that could help with their stress level, and that can help with tummy pain. Other thing is the medical treatments. We can give the medication that can slow down the movements of the tummy, and it can help with the tummy pain. How about we shall try those kinds of things measures fast. If not improved, then probably we can arrange for the jelly scans later. How did that sound to you?
Yeah, okay. But I know why you are not giving the treatment, because we are Arabs person. That's why.
Oh, Miss Mira, do not think like that. We treat every patient of us equally, and we don't give unnecessary treatments. That is probably first of all, if we arrange the ultrasound to Rooney, the one who really need the ultrasound would probably would affect, because we give someone who is not necessary, and that could affect the treatments of other children who require that facilities. And that's why we don't give that ultrasounds or jelly scans option for you. I hope you understand, Mrs. Mira.
Yeah, I understand, but I want to go another hospital.
Oh, I'm really sorry that you just decided this way, but we are so much happy, and we just open our arms to give treatment to the Roni every times, and but it's up to your decisions to choose which facility you want to choose. But for us, we are really happy to take care of the Rooney.
Okay, I'll
All
complain
right.
against you. Don't worry. You guys are not helping me. I'll complain.
Oh, Mrs. Mira, I'm really sorry that you feel this way. So I think I just tell you a lot. How about I summarize so that you can understand?
Okay, you can summarize.
Okay. So I have explained why Rooney doesn't need a CT scans or jelly scan of the tummy. It is because of the tummy pain causing the Rooney is simply a functional abdominal pain, which is like there isn't any problems going on inside the tummy. The problem is probably because of the external or stress factors causing the Rooney feeling pain inside the tummy. For that, I'm giving you the options like how to handle the stress, or I will give you the medication to slow down the gut movement. I will arrange another meeting if you are happy. You can come and see with me maybe about 2 or 3 weeks later, just to see how Rooney cope with those measures. How does that sound to you, Mrs. Mira?
Okay,
Okay, I'll give you the leaflets, the websites, and also the facilities that can also help with the child with those problem. If you are happy, you can also have discussions with those people. Hope to see Rooney come back with me next few weeks with a good health. Thank you so much for your time.
thank you. I think 5 second or maybe fully 9 minutes you completed. So I want to tell you that first you tell me probably that is a functional abdominal pain. No, it's
Mm.
fully diagnosed. It's a functional
Yeah.
abdominal pain. Okay.
Yeah. Yes.
So that is fully diagnosed. And why we are not, it is a way her body, okay, I can understand your feelings. It can be scary, but let me reassure you that the tummy pain in Ronnie's condition, it is called functional abdominal pain. What's that? It is a way her body react with stress, but there is nothing wrong inside her tummy. I'd like to do with the CT scan. May I know why? Because of the cancer. Okay. Oh, I really understand. This is must be scary, but let me reassure you that we examine him and he doesn't need the CT scan. Why not? Because CT scan is a very big scary machine. He has to be sleepy, keep motionless for at least 45 minutes, which may need sleeping medicine, and he will be exposed to high dose of radiations and drawbacks of sleeping medicine. So he is only will get drawbacks for no reasons. About jelly scan, ma'am, I admire your knowledge. I can understand you want the best of your child. I can get that. But let me tell you that jelly scan is also stressful. How? Because he needs to drink a plenty of water. We will prevent him from peeing for being very long period of time. This will add to her stress and will increase her pain. So at the end of the day, instead of helping him, we add him pain. Okay, doctor. So you do not need any treatment as we are Arabs. So Arabs, the answer is like that. I'm really sorry you got this impression, but we are treating all patients equally regarding their age, their gender, and their ethnic group. I want to go another hospitals. Answer is that every hospital will do the same because all of us searching for what is best for Ronnie. And I will show the quote that is she's giving. Then, ma'am, we are trying the best for Rooney and we'll give you some solutions. What is the treatment? Treatment, how can we tell? First, painkiller we are giving. Also, we'll introduce him to a doctor who will help him to express his stress in a healthy way. Are you think my child is crazy? Actually, I do not think that he's crazy. I think he's very smart because this type of pain occurring in super smart kids, we just want to help to express him stress in a healthy way. So, two treatment we are giving. One is painkiller, another is a doctor we are involving who is helping him to express the stress in a healthy way. The psychiatrician telling. Another complaint I will pause if I am to go. Another thing, red flag you need to tell at the end. Let me tell you if there is any, when you need to seek medical advice. Let me tell you if there is any throwing up, losing of weight, blood in the poo. At any time, you should seek medical advice immediately. So, throwing up, losing weight, and blood in the poo. Okay?
Okay. Thank you.
Most welcome.